All right, there we go. So welcome to the Medicare Cost-Assistance Programs webinar. Again, I'm Adrienne Franklin here in the Aging Commission of the Mid-South, SHIP Program Coordinator. And then later on, you'll be hearing from Lonnie Hitchcock, the statewide Senior Medicare Patrol Coordinator. All right, so just a quick little history on what is SHIP. We are the State Health Insurance Assistance Program, and we help Medicare beneficiaries in Tennessee understand Medicare and find the best possible plans available to them right where they live. And we do this in a variety of methods. Outreach, which is part of what we're doing today. We're reaching out into the community via the internet. And now that the pandemic is slowing down, we will start getting back out into the community physically. Education, which this also falls under. Counseling. So we provide one-on-one counseling by phone, online, even in person, and then also assistance. We assist people as they enroll in different parts of Medicare, and also, which is the focus of today's webinar, with the Medicare Cost-Assistance Programs. So the programs I'm going to go over today, we have Medicaid, which in our state is called TennCare. It could be called something else in a different state, but here in Tennessee, it is TennCare. So that is Medicaid, and that is the federal state health insurance program for people who have limited income and or resources. We also have the Medicare savings plans, and these programs pay for the Medicare Part B premium if you're eligible, and we will go into detail on each of these. And then there's Extra Help, also known as Low Income Subsidy, or LIS, and this program can help lower your prescription drug costs through Medicare, your copays and premiums if you are eligible. So now just a quick look at the differences between Medicare and Medicaid, because a lot of people confuse the two. I'll have people call constantly telling me that they need help with their Medicaid when they really need help with their Medicare, and vice versa. So to try to make sure that we have our Medicare versus Medicaid correct, if we look on the left-hand side, Medicare is a national program that is consistent across the country. It's administered by the federal government. This is health insurance primarily for people who are age 65 and older. However, if you're under 65 with certain disabilities, or if you have end-stage renal disease, so that's when you have kidney failure and need a kidney transplant, or ALS, you can qualify for Medicare. And then the Medicare is also the nation's primary payer of inpatient hospital services to adults with disabilities, to the elderly, okay, people might not like that, to people over 65, and people with ESRD and ALS. So that is Medicare. So that's the one I tell people that in most situations, you age into Medicare, with some exceptions, as we have mentioned. Medicaid, on our right, these are statewide programs. They vary from state to state. So what the rules are in Tennessee are not necessarily the rules in Arkansas or Mississippi or California, Hawaii. They're going to have some different rules. So they are administered by each state. However, they do still have to follow federal rules. They still have to operate within federal guidelines. They are funded federally, but they are run by the individual states. This is health insurance primarily for people based on their need. And that need includes both financial and non-financial requirements. So, and again, this is going to depend on the state. Some states have more expansive Medicaid programs than others. So if you meet certain income requirements and possibly certain medical requirements, depending on your state, you may qualify for Medicaid. So this has nothing to do with your age. Being 65 is not relevant to the situation. It has to do with both your financial and non-financial requirements as dictated by your state. And Medicaid is the nation's primary public payer of acute health care, mental health, and long-term care services. So those are the primary differences between Medicare and Medicaid. So if you're not sure of what you have, of course, you can always call SHIP and we can help. Probably the best way is just look at your card. Each program issues a card and it will tell you what you're in. Medicare is red, white, and blue, and it says the word Medicare. Let's go ahead and mute everybody. Just a moment. All right. Okay, so there we go. All right, so now we're going to go to our next form of Medicare cost assistance program. So we have Medicare savings plans. So there are actually 4 types, but we're going to go over the 3 most common types of Medicare savings programs. We have the QMB, the SLMB, and the QI1. All 3 will pay for your Medicare Part B premiums. QMB will also pay for your Part A premiums if necessary, as well as your Part B copays, coinsurances, and deductibles. And we'll talk a little bit about these 3 in more detail in a moment. But just to summarize, all 3 will pay your Part B premium, but they do differ because you have different income requirements for each of these 3 programs. QMB is going to be, as you'll see in a moment, for the lowest income bracket of what qualifies. So if you are QMB, it will pay your Part B premium, your Part A premium, if you're in the category of people who have to pay Part A premiums, which is rare, but also your co-pays and co-insurances and deductibles. All of these programs are administered by TennCare. And I think this is where some folks get confused because they see TennCare, they think they have Medicaid. Just because you have one of these 3 does not mean that you have full Medicaid. So if you're ever unsure, call TennCare to be certain of what your program is. But these are administered by TennCare. We can help you apply. Always call SHIP if you need assistance with applying, or you can apply directly online for people who like doing stuff online, and you can see the website there, tenncareconnect.tn.gov. So eligibility for these programs, let's take a look at the first one, Qualified Medicare Beneficiary, or QMB. I've even heard some people say QMB. Okay, but to qualify for this, and we're talking mainly about 1- and 2-person households. If you do have dependents, therefore you have maybe a 3- or 4-person household, then this, there will be different income and eligibility levels. But for the most part, we're dealing with either single individuals or married couples living together. So if you're a single person and no dependents, then your maximum monthly income to qualify for QMB would be $1,094. And that is before they take out your Medicare Part B premium. So that $148.50 that they take out from Medicare, that needs to be included when people ask you, what's your income? And now some people don't know. They'll just say, all I know is what hits my bank is $900. And I'll say, well, okay, then $900 is what hits your bank. We'll add $148.50 to that. So that means your income is $1,048.50. So you still, as a single individual, qualify on income, at least, for QMB. Now, you also have resources. In Tennessee, you have to qualify based on income and resources, and your resources cannot go above $7,970. Resources include things like secondary property. So not the property, if you own property and you're actually living on that property, they don't care about that. But if you have any additional property that you're not living on, they do care about that, and they'll want to know the value of that secondary property. If you have a secondary vehicle as a single person, your first vehicle, that's fine. They don't care what that's worth because they expect you to be able to need to drive around town. But if you have another vehicle in your name, they will take that vehicle into account. And also things such as checking accounts, savings accounts, and everyone, let's just be clear, a savings account or a checking account, those are indeed bank accounts. Because I've asked people sometimes, do you have a bank account? No. Then we get to the end, but I got a checking account. That's at a bank, right? That's a bank account. So your checking, savings, CDs, any stocks, bonds, let me think what else counts. Certificates of deposit, trust funds of certain kinds, any of those things, IRAs, 401ks, so any of those would qualify as resources. Now, one thing I didn't put on here, and I should have, so I apologize. If you have a separate resource for burial expenses, like you have an irrevocable burial account, you can have $1,500 in that. So that would be added to the $7,970. So if you do have $1,500 to be accounted for your burial expenses, then you can go above that $7,970 for $1,500, and that's per person. So now for QMB, if you are a married couple, 2-person household, then together your income cannot go above $1,472. And again, that is before they take out for Medicare. And I know a lot of people, they argue about that, but that's going out and I don't have that money. I know, trust me, I know, I understand, I sympathize in every single way, but that's the government and they're going to count that in there. So your max monthly income as a two-person household, $1,472. And for resources, it's then $11,960. And again, if you do have that separate, resources for burial, you can have $1,500 per person. So you can actually add $3,000 for burial to this $11,960 for a married couple trying to qualify for QMB. Oh, and I see we do have a couple of extra folks who have joined us. Welcome. Thank you. And if you would just type your name in the chat so we can record your attendance, we appreciate that. And a couple of times during this presentation, we're also going to make you aware of a survey that we'd love for you all to participate in. It's completely voluntary. You can do it at the end of the webinar, but don't be surprised if you see that come up a couple of times. But please do put your name in the chat. Thank you. So also moving on from QMB, we now have the specified low income Medicare beneficiary, or SLMB. So that's our next category for the Medicare savings plans. So again, this will pay, if you qualify, your Medicare Part B premium, which this year the base premium is $148.50. So SLMB will pay that. However, it will not pay any copays, deductibles. QMB will, SLMB will not. So that's the main difference there. If you are a single person, one-person household, your max monthly income is $1,308, including your Part B premium. So again, if you don't know exactly, if you've lost track of your Social Security letter that they send once a year to let you know what your benefits are, and you're not able to get a hold of it, and you say something like, all I know is $1,000 hits my bank once a month from Social Security. Okay, then we're going to add that $148.50 back to that $1,000 that hits your bank in order to get your total income. If you're only, now let me just say this, and that's if your only income is Social Security. When we say max monthly income, we mean any income. We've mainly been talking about Social Security because a lot of people, that is their only income. But if you get any other income, if you have a retirement pension, if you get alimony or child support, if you cut grass and you list that on your tax returns that you cut grass, that's all in your monthly income. So, please do report that accurately because they will check your records to make sure. So again, SLMB to qualify, one-person household, $1,308. The resources are the same as in QMB. That does not change, so I won't bore you with that again. But so same resources, $79.70. If you are a married couple living together, two-person household, then your maximum monthly income for SLMB, $1,762. And again, the resources are the same as a married couple for SLMB as it would be for QMB, that $11,960. So that does not change. Let's go on to our next Medicare savings plan. So now we have the qualified individual one, or QI1, or sometimes you may just see QI. If you are one-person household, single, that is $1,469 is your maximum monthly income. And then, of course, same resources, $79.70. And if you have the additional burial, you can have an additional $1,500 for resources if that goes towards your burial expenses. As a married couple, two-person household, $1,980 is your maximum monthly income. And again, same resources as before, $11,960. And you can add per person $1,500, so a potential extra $3,000 for burial expenses can go towards that, be added to that resource amount. Now, here's one thing that's different about QI1 from SLMB. QI1 will pay your Part B premiums as long as funding allows. QI1 does not, I guess, come from the same, it doesn't come from the same well, for lack of a better terminology. It doesn't come from the same funding source as QMB and SLMB does. So if you're in QMB and SLMB, you will have that until such time as when they go to renew and make sure that you still qualify. As long as you still qualify, you still have it. If you don't still qualify, then you'll either be moved into a category that you do qualify for, or it will end at that point. But it won't end because of funding. It will end because you either didn't respond when they asked you to respond, or you did respond and you just no longer qualify. QI1, on the other hand, however long they've got the cash, they're going to pay your Part B premium. They run out of cash, they're not paying your Part B premium anymore. And you will need to reapply for the upcoming year if you are still just in the QI1 category. So that's important. Again, you can see at the bottom where I did write it in here. Awesome. So at the bottom where it does say an additional $1,500 per person for burial costs can be added if it's in a separate account than your main checking or savings. So that is an important distinction. So now we're going to move from the MSP to extra help. Now, earlier I said that the MSP, the Medicare Savings Program, those are run by TennCare. Extra help, or the low income subsidy, also known as LIS, is actually administered by Social Security. So different organization runs this program. And this provides assistance with your Part D premiums as well as with your Part D copays. And when I say Part D, in this instance, I'm merely talking about Medicare prescription drug coverage. If you're getting that drug coverage through a Medicare Advantage plan, as long as it includes drug coverage, you still can get this assistance because you do have Part D. You're just getting it as part of your Medicare Advantage program and not as a separate Part D. So don't let that throw you off and go, oh, I can't apply because I have an Advantage plan. Yes, you can. Please do apply. So again, it is administered by the Social Security Administration. Now, you may automatically qualify for LIS if you are in one of these categories. If you have full Medicaid coverage. So that first thing that we talked about at the beginning of the webinar when we talked about end meeting warning. Let's continue. I don't know why that is, because that should have been listed for an hour and a half, but we'll go ahead and continue. So I've done that. Can you all still see my screen? Can you just write me in the chat? Can you all still see the PowerPoint? No? Okay. Yeah, I thought it knocked it out when it gave me that warning. So let me pull it back up. Just one moment. Okay, and okay, how about now? Is it back now? Okay, great. Yes, thank you. All right, so I apologize. It's the Monday gremlins when it comes to IT. Let's just put it on that and keep it moving. All righty, so extra help, you may automatically qualify if you have full Medicaid coverage. So Medicaid, the first thing that we talked about, if you're in TennCare full coverage, you will automatically qualify and be enrolled into the LIS program. Also, if you are in a Medicare savings program, you will automatically qualify for LIS. And if you receive supplement security income, you also will qualify for LIS. So those are important distinctions. Everybody else needs to apply, and you can do that again by calling SHIP, or you can go online to Social Security's website at ssa.gov. There really is no paper application. You can call Social Security and request a paper application. I've tried that. It takes a while to get to that screen for them to send you a paper application. It may be easier to just call SHIP, and we'll have our number up later. It may be easier actually really to just call SHIP and let us help you with that. Or if you really like doing stuff online, just going online, then asking for a paper application. That can be a little wiggy. But yeah, so those are the ways that you can apply for LIS. And they do have income and resource limits. Now, let me also say this. Remember that the Medicare Savings Program, since it's run by your state's Medicaid agency, those requirements can vary somewhat from state to state. But because LIS is run by Social Security, this is a federal program. So this is going to be true if you're here in Tennessee, if you're in Mississippi, Arkansas, whatever, this is going to pretty much remain the same because this is a federal program. So your income limits for LIS or extra help, if you're a single person, one person household, the maximum is $1,630. That's your maximum income. Now, I do know if you're just a smidge, and I do mean a smidge, over, you might still be able to, I would tell people go ahead and apply anyway. They're just a bit more lenient, I guess, than the MSP. MSP, I'd still take a shot, but don't be too surprised if it doesn't work, but I'd still take that shot. LIS, if I'm a smidge over, I'm going to go ahead for it because, they might go ahead and do that. They're a little bit more lenient with that, just a bit. Okay, so $1,630. And when I say a smidge, I don't mean $900, people, just a smidge. But $1,630 maximum. And again, that does include your Medicare Part B premium that you're paying. Married couple, two-person household, maximum income, $2,198. Now, your resource limits are higher than they are for the Medicare Savings Program, just like the income limits are higher. So as a single person, your annual... not your annual. Your resource limit for a single person, $13,290. Married couple living together, two-person income, $26,520. And as I said before, these do include your bank accounts, any investments, 401ks, IRAs, all that good stuff. Again, they don't count the home that you live in. So that's not a concern, but they do look at your bank accounts and anything else of that nature. And also they will allow for an additional $1,500 per person for burial costs if it's in a separate account. So that can go above what these limits are here for your resources. When I tell people, now some folks, they want to know, should I apply for both? Sure, in most cases, you can apply for both. If you apply for the Medicare Savings Program only and you qualify, you will automatically be put into LIS. But I have had people who applied for LIS first, then came back and applied for the Medicare Savings Program. It does not hurt in the slightest. And it's important that you know that you can apply just for extra help because, as you can see, there is that gap between the highest amount you can have in MSP, which, let me go back just a sec. So as you can see here, qualified individual one, QI1. So the highest you can have to get into any of the three Medicare savings programs, since QI1 is the highest, as a single person, would just stay there for a second, $1,469. Whereas with the low income assistance single person, $1,630. So you do have a gap where some people won't qualify for the Medicare Savings Program, but they will qualify for extra help. So definitely take advantage, don't give up if you see that, oh man, I don't qualify for the MSP. Well, let's take a look and see if you still might qualify for extra help. Some help is better than no help. And with the way drugs are costing these days, even if all the help you get is with your prescription premiums and copays, that's better than getting no help at all. So please don't get discouraged if you feel you don't qualify for the MSP. Let's take a look and see if you still might be able to get in for the low income assistance. And again, I'm showing here single person and married couple, but if you do have dependents, therefore you have more than a two-person income household, then they will take that into consideration, and they do have higher limits depending on how many people are actually in your income as dependents. All right, so the benefits this year of having the extra help program. When you're in extra help, you may qualify as full extra help, so you're getting 100% assistance, but you may also qualify as partial extra help, and they have three categories of that. You may qualify as getting 75% assistance, 50% assistance, or 25% assistance. Now, the premiums for Part D prescription drug plan, Medicare prescription drug plan, if a plan participates in this program, not all of them do as far as the premiums go, but for the plans that do participate in this program for premium reduction, they can reduce your premium by up to $30.20 because that's the benchmark. And yes, I will, thank you for asking. Yes, I will definitely send presentations out to everybody after the webinar. Thank you. But yes, so $30.20, they can reduce your Part D premiums up to that amount. So let's say that you have a participating program and heck, their premium was only $19 in the first place. Well, if you're getting full extra help, They're paying that whole 19 bucks. Let's say you have a participating plan that their premium is $33. Well, they're going to pay $30.20, which leaves you with $2.80. $2.80. Yeah, that's right. You can look at it that way. Now, this will also, if you're in extra help, you'll have reduced co-payments. The maximum you would pay for those on full extra help would be $3.70 for generics, $9.20 for brand names. And the reason I say maximum is there are a couple of different levels even within full extra help, and that is way too much technical detail for us to go into today. But that's why I'm saying maximum, because there are some people who may pay actually even less than this. But the most someone on full extra help should pay for their co-pays for their prescriptions, $3.70 for generics, $9.20 for brand names. And of course, you do want to make sure that the prescription you need is covered by the particular plan that you're on. Now, if you are on partial extra help, then you would only pay a 15% copay. So instead of the $3.70 for generics and $9.20 for brand names, it could be more than that, but whatever the copay would normally be, you would only be asked to pay 15% because you're on partial extra help. Now, the Part D deductible. For standalone Part D drug plans, the maximum deductible is $445. Things work a little bit differently if you have a Medicare Advantage plan when it comes to deductibles. So if you receive full extra help, then you don't have a Part D deductible. That's zero. If you are on partial extra help, then your deductible would be $92. So partial extra help, you have a maximum deductible of $92 instead of a max deductible of $445. There is no coverage gap, or you hear people call the donut hole, when you are on extra help. And also, they will waive your late enrollment penalty. So let's say that you did not enroll in a Medicare Part D plan or a Medicare Advantage plan with drug coverage when you were first eligible to do so. And in addition to that, you did not have creditable coverage, either through a job or through a retirement plan, VA, TRICARE, whatever. You did not have creditable coverage, which meant you could delay or not even take a Medicare Part D plan. That usually means if you do sign up for a Medicare Part D plan, you're going to incur penalties for being late. However, if you qualify for extra help, they will waive that late enrollment penalty. And that's also a benefit, forgive me for not putting it on here, that's also a benefit of the Medicare Savings Program. If you did not sign up for Medicare Part B at the time when you were supposed to, and you were not covered by creditable coverage, which would have allowed you not to sign up at that time, and therefore you would have gotten a late enrollment penalty for your Part B, then having a Medicare Savings Program like QMB, SLMB, or QI1 will waive that late enrollment penalty. So that's a benefit of the Medicare Savings Program that I forgot to mention. And it is a benefit also of the extra help that for your Part D, that penalty is waived. All right. Now we have the Limited Income Newly Eligible Transition Program, also known as LINET. Well, that's what I call it. That's the initials. I've heard people call it LINET and other stuff. I call it LINET. You can see what it says, LINET program. So what is LINET? This is a CMS program, CMS being the organization that runs Medicare and Medicaid. It's a CMS program that provides temporary prescription coverage for people who qualify for extra help, but don't have a drug plan, don't have any prescription drug coverage. So how this happens is, for instance, one time I signed up someone, we knew that she was going to have a late enrollment penalty. That was hands down going to happen. But it also looked like she was definitely going to qualify for low-income assistance. So what she decided to do was she held off on joining a drug plan until she secured having extra help. That way, when she did get a drug plan, she didn't even have to worry about, refunds and all this. She knew she would go in and not have that penalty. So because she held off on getting a drug plan, she enrolled, she was put into the LIS program. And so then I was like, cool. So I did sign her up for a drug plan. However, and I can't remember the months, so I'm just going to make them up. So what are we in, June right now? Okay. So let's say that this happened last month. She was approved for LIS in May. I signed her up for a drug plan, but it won't start until July 1. So she needs to get prescriptions during that time, well, this is what LINET does. It allows you to show proof that, hey, I am approved for extra help. I am approved not to pay a gazillion dollars for Genumet. It's administered by Humana. You can see there's no premium, so you don't have to pay to be in the LINET. You will get those LIS-based copays, and it usually lasts up to 2 months, generally because it takes that long for your new plan to kick in. If you do happen, let's say she didn't do it that way. Let's say that she had signed up for a drug plan and for about a month had paid more than she would have if she had gotten extra help, and then she got in. They can do some retroactive reimbursements for out-of-pocket expenses, so that can happen. But in the case of the person I was helping, she held off on getting a drug plan, so she needed LINET to go get her drugs until her drug plan started the following month. Also, if somebody gets LINET and they just don't choose a drug plan for whatever reason, they couldn't make up their mind, or they really just forgot that they needed to choose one, CMS will choose one for them. They do not want them to be without coverage. So that can happen as well. Because people go, how do I get this AARP plan? I'm like, you got LIS? Yeah. Did you ever call me back when I asked you to so I could put you in a drug plan? Nope. Yep, that's how that happened. Medicare put you in a plan, which we can change. But that's the benefit of the LINET program, is that it will allow someone to go and get his or her prescriptions when they need to at the reduced price until their new drug plan finally kicks in, usually within a month or two. And oh, goody. So I am coming up on the end of mine. Let me just put this up really quickly. So my contact information before I turn it over to Lonnie. I'm at the Aging Commission of the Mid-South. We are downtown. We moved a few months ago, but for those who are new to that, we're downtown, 160 North Main, 3rd floor. You can call us at either 222-4111 or that toll-free number there. You can email us at ship.smp@agingcommission.org. And you can see we are on Facebook, we are on Twitter, and you can always call SHIP toll free at 877-801-0044. So if you ever lose our local number, that's okay. Just call our state number. They'll get you to us. Or you got a family member that lives in Haywood County, give them the toll free number and they can definitely make sure, because, you know, I don't always have Haywood's number off the top of my head, but if they call this toll-free number, they can get them there. And you can see here at the bottom, we do have the link, which I will put in the chat in just a sec. So at the end of today's webinar, or when you have time and over the next day or so, if you wouldn't mind doing this anonymous survey. If you prefer a paper survey, I can send that around by email when I send around the PowerPoints. So I'm going to, well, actually, let me take a quick pause so we can just see if anybody has any questions over the part that I just went over before we throw it to Lonnie, kind of give you guys a chance to have any questions if you need. I'm going to unmute everybody. Okay, so if you have any questions, well, I tried to unmute everybody. You might have to unmute yourself, sorry. But if you have any questions, go ahead and throw them out. In the meantime, I'm going to put this survey link in the chat. And if we don't have any questions in the next minute or so, I'm going to turn it over to Lonnie. So go ahead and shout out whatever you like to. Let me see if I can learn where the chat button is. Okay, so you should have the link in the chat room. And I'm not seeing anybody or hearing anybody jumping in, so I'm going to assume that everybody is A-okay. All right, and with that, Lonnie, I'm going to see if I can give you the ball. Just a second. Okay, so
Alrighty.
Yay, it worked.
Okay. All right, good morning. Now let me share my content here. Okay. It went blank. There we go. All right, now can you see it? Okay.
Yes.
So from beginning. Slideshow from beginning. All right. How is that?
Yep, we got you.
All righty. Good morning, everybody. So you just now learned a little bit about the Medicare savings programs and everything. So, or the Medicare Cost-Assistance Programs. So what I'm going to be talking about today is a little bit about how to protect yourself from fraud. So the SMP programs, SMP actually stands for Senior Medicare Patrol, and I deal with Medicare fraud, waste, abuse, and billing issues. What I deal with is a lot of Medicare cost sharing / balance billing issues. So that's what I'm going to be talking about today, about, protecting yourself, about paying unnecessary bills. And how this came about is balance billing is a practice when a Medicare provider seeks to bill a Medicare beneficiary for Medicare cost sharing, even though that Medicare cost sharing is supposed to be sent to TennCare. And what they try to collect sometimes is deductibles, coinsurance, and the co-payments. Okay. So, we have this was in 2013, so we probably have more than that now. We have over, 10 million people that have both Medicare and Medicaid. That means that they are dual eligible beneficiaries. And we have, 65% that are qualified Medicare beneficiaries, QMB. So, for example, QMB, or that part of TennCare, that QMB, qualified Medicare beneficiary, actually pays their Medicare premiums and their cost sharing. So, Adrian went over those resources for people to qualify for QMB. So, unfortunately, the state of Tennessee is a lesser of state, and lesser of means that, in a nutshell, if Medicare pays their contracted amount, and if TennCare's contracted amount is either the same as Medicare's or lesser than Medicare's, then TennCare will not pay that coinsurance. But that also means that the providers are not supposed to balance bill the beneficiaries. They're actually supposed to write that off if TennCare never pays. So that's why sometimes the beneficiaries actually get some of these bills, is because the TennCare didn't pay anything. It's because they've already paid the TennCare amount pretty much when Medicare paid. So that's what it means by lesser of. I know it's kind of complicated, but it's actually a federal law that providers are not supposed to balance bill beneficiaries. So explaining the kind of lesser of. So, for example, if the Medicaid rate, full payment is $74, the Medicare rate is $80. The Medicaid reimbursement for that, 20% of 100, we'll say, is supposed to be $20. So if Medicare go ahead and pays their, 80%, which was $80, and the Medicaid rate is 74, Medicaid is not going to pay anything because Medicare has already paid the Medicaid rate and more. So that's why, kind of explaining the lesser more, as you can see here. So, but, with them having Medicare, they actually do have protections. Providers are not allowed to charge QMB, and this is just for the beneficiaries that have QMB. If they are qualified Medicare beneficiary, they are not supposed to balance bill them. And here's the federal law that says that. And this applies to all providers, not just, this is all providers that one take Medicare, take original Medicare, and ones that take a Medicare Advantage plan. And QMBs cannot waive their status. That's another thing. You can say, well, I've got QMB, but I still want, the service or whatnot. They can't waive their QMB. And here's the regulation for Tennessee. So all QMBs are actually protected from balance billing. All Medicare physicians, providers, and suppliers who offer services and supplies to QMB may not bill QMBs for Medicare cost sharing. Any payment, if any, made by the state Medicaid plan shall be considered payment in full. Providers will be subject to sanctions if they balance bill. Can a QMB waive their protection? No. QMBs have no legal obligation to make further payment to a provider or Medicare managed care plan for Part A or Part B cost sharing. Medicare providers who violate these billing restrictions are violating their Medicare provider agreement. So if they're in a Medicare Advantage plan, yes, they are still protected. So it really does not matter which plan that they are in, they are still protected. And a lot of Medicare Advantage plans must include in their contracts with providers this protection also. And of course, with the contract, the regulation binds the Medicare Advantage plans and the contract actually binds the providers. So both are actually responsible for compliance. So that's another good thing if you have an Advantage plan. So here's an example of some of the things that I've dealt with before. Alice is in a fee-for-service. She's in original Medicare and also a QMB. Alice is having an outpatient procedure performed by Dr. Abel. When Alice arrives for her appointment and shows her Medicare and her QMB cards, and actually TennCare mails out the QMB cards quarterly, she is told that her procedure will be canceled unless she signs an agreement to pay charges that Medicare won't pay. Alice signs the agreement and has the surgery. Alice can't afford to pay the coinsurance and is getting collection notices. So sometimes I have this happen all the time. Even though they're a QMB, the provider has actually violated their provider agreement by making her sign this agreement, even though the doctor knows that she has QMB. So does Alice have to pay the Dr. Abel? No. The agreement is invalid because remember, she can't waive her QMB. So that agreement is actually invalid. And actually Dr. Abel is subject to sanctions if he continues to seek payment from Alice. So what happens if Dr. Abel isn't enrolled in Medicaid? Does that make a difference? No, it actually does not. And this is all Medicare providers who accept assignment must conform to the QMB balanced billing protections, even though they may not be enrolled in Medicaid, whether or not they accept Medicaid. Is there any way that Dr. Abel can get paid? Yes, he can submit the claim to Medicaid. It's called crossover. But keep in mind, that lesser of, most states only pay up to the Medicaid authorized amount. So the provider may receive little or nothing, but, they can still try to, submit the claim to Medicaid or TennCare in this state. Could Dr. Abel have simply turned Alice away because she was a QMB? Unfortunately, yes. And I see this quite a bit. For example, I had one where, she recently got enrolled in QMB, and she had been going to this physician for years, and the physician was like, "I'm sorry, since you now take QMB, I can no longer be your physician." But the thing is that physician actually did refer her to other physicians that would, that she could go to. So he actually gave her some other options. So that was good. But yes, unfortunately, providers can turn beneficiaries away if they know that they have QMB. So when do balance billing protections not apply? So these do not apply if Medicaid copays, if your state imposes Medicaid copays, so the provider may implement them. This does not count for Part D, prescription drug. This is only for Part A and Part B, or if they're having an Advantage plan. So this doesn't count for the drugs at all. If there's someone is on an Advantage plan and they go to an out-of-network provider, In order for a QMB to maintain their status, if they have a Medicare Advantage plan, they have to stay within those networks. If they go to an out-of-network provider for that Advantage plan, then they're pretty much out of contract with that Advantage plan. So yes, they could be subject to having to pay these bills because they went to an out-of-network provider. So in order for the Medicare Advantage plan and the QMB to work together, they have to make sure that they are going to an in-network provider. And of course, it does not apply if the service or providers are not covered by Medicare. For example, if this provider, it does not take Medicare assignment. Also, it does not pay for, it doesn't apply if its service and Medicare does not cover. For example, plastic surgery. We know Medicare does not really cover plastic surgery. So you have to make sure that Medicare covers the service first before your QMB can apply. So what are some steps that beneficiaries can take to help balance billing from occurring? Make sure, I tell beneficiaries, if they have QMB, do not pay the bill. Don't pay the bill first. Make sure, talk to their provider to make sure that the provider knows that they are QMB. They may have forgotten to give them their QMB card or something like that. They give them a Medicare card, but they forgot to give them the QMB card. That can happen sometimes. Make sure your Medicare Advantage plan knows that you're a dual. Make sure your Advantage plan knows that you are QMB. Another thing that I tell, make sure, if you're talking to your provider, make sure that they know about the balance billing protections. That they're actually violating federal law by balance billing you. If someone if they're on a Medicare Advantage plan, if they're having an issue with a provider, they need to actually call their Medicare Advantage plan. So that plan can actually work with that provider and either educate them, get them to stop billing them. Sometimes they can do like a three-way call with that Advantage plan and that provider and get that worked out. That way, they at least let the Advantage plan know what's happening, that they're getting balance billed. There's actually model letters that the Justice and Aging has done. You can use those. This is the kind of letter that I usually send out. I send these out all the time to providers who are balance billing beneficiaries. So you can write a letter, and here's some model letters in this link. We'll be sending this out. So if you've done all of that and still nothing, they're still trying to balance bill you, please definitely give me a call, and then I can send it up the line. Usually this is, if they're trying to balance billing, then they're trying to form, this is, Medicare fraud. So, and I can get the provider a complaint done so that, Medicare will know about the provider and, whatever they have to do to educate them, sanction them, whatever they may have to do to get them to correct this. But if you all have done some of this stuff and, talk to a beneficiary or anything like that, that's done all these steps, please, if you contact me, let me know what steps that you all have done already, trying to get this situation corrected. That way I can put that in my report and say, we've already done these steps or what, and they're still balance billing beneficiary. So here's some federal of the resources, a lot of the wording and stuff like that, the regulations and stuff like that. So it goes over balance billing, anything like that. So it's very helpful. And I'm going to give you another case study. David, a Medicare beneficiary duly enrolled in Medicaid, contacts the S&P because he received a notice from a collection agency to pay for more than $5,000 to a hospital that treated him for a serious illness 2 years ago. This was the first time anyone contacted him about a bill. He was surprised to be billed for the charges not covered by Medicare because Medicaid was supposed to cover them. In addition to the notice from the collection agency, the hospital sent him a letter saying they were going to sue him. David was distraught and overwhelmed. So, of course, what is wrong with this case study? And so where do you go from here? Usually I will tell David or ask David if he's contacted the hospital to let them know that they can't balance bill him. Usually what I will ask David for is a copy of his Medicare summary notice as to where Medicare paid, because most of the time in those Medicare summary notices, and that's that document that beneficiaries get quarterly on what Medicare paid and what they may owe and stuff like that. I will ask him for a copy of that if he still has it. And if not, then I'll call Medicare and ask for a copy of that for when he was in the hospital, so I can see if Medicare denied anything. Because if Medicare denied something, then he would owe it, because if Medicare denies something, then Medicaid is not going to pay for it. So that's some of the things. That's the first of what I would start with. But another thing, ask David to make sure that he told the hospital that he has QMB or TeamCare outright. So that sometimes gets confusing. They get the Medicare part, but somehow they drop off on or they don't get their copy of their TeamCare card or copy of their QMB card. Sometimes that does happen. So that's some of the things that I tell beneficiaries trying to do in the front end. So I'm pretty much done. Does anyone have any questions for me or Adrian? We'll open the questions up for both of us.
Thank you, Lonnie. That was, I didn't know some of those things, so thank you very much. And yes, everybody, you have the ability, you can unmute yourselves and ask, or if you'd rather type your question in the chat, you can actually do that as well, just whichever you prefer. And again, yes, we will definitely be sending these presentations around to you by email.
Okay, here's the survey again. Please take the survey. It's not necessary, but we ask that you please do, because HCL is tracking these to see how well we're actually doing, talking to beneficiaries and things like that. So it's anonymous. You don't have to put your name or anything in. We just ask that you please do this.
And if you do prefer the paper copy, I'll send that around as well. It's still anonymous. You can still just mail that back in, so that way we won't know who it comes from. You can mail it to me or even to Lonnie, and you can send it to us, no names or anything, and we won't have a clue. So if that works best for you, that's fine as well. And I do have the survey link in the chat.
Here is my contact information if you need it. And of course, you all know Adrian's contact information. Or at least I hope you do. But they will both be in the PowerPoint. So
yes.
Any questions? I guess we did so well, Adrian. We don't have any.
I know. I'm going to take that as a compliment. Well, if you all don't have any questions, and I'm still here, you can still ask. If you think of something later, and you're like, darn it, that's what I should have asked when we were on, feel free to shoot us an email or give us a call. We'd be happy to, answer any questions that you may think of later. I know I do that. I'm one of those 3 a.m. types. No, I won't call you at 3 a.m. I'll just write it down, hopefully, and be able to read it in the morning. But yeah, in fact, what I'm going to do is I'm going to go ahead and stop recording just in case some of you are shy and don't want to ask on a recorded feed. So let me go ahead and do that. And we're going to stop recording.